Dear
colleagues, good afternoon. I'm very happy to see all of you, some of you in person who are attending in the studio, others are online. And of course, coronavirus has introduced certain changes in our communication, but I would like to say that this communication has attained a better quality, more personalized, quicker. And so we decided that today's main session, because to me this is the main session, since the healthcare issues and the approaches to organizing healthcare, is something that 2020 has identified as extremely important to all of us, not only to Russia but to the whole world, but as far as we're concerned, who are continuously living through the reformation of healthcare and through a continuous turbulent challenges and changes, this topic becomes a core one. And so we decided to have a candid conversation without any slight discourse around a very important topic, which is a patient-centric healthcare model. And we also decided to add to this another thing, whether all the pills are equally good for us. I mean to say that healthcare generally, that is what we're going to begin with, as a system, as something that contains so many processes, and healthcare in individual issues in as far as the provision of medicine is concerned. I would like to introduce to you our esteemed speakers, and I'm sure that today's conversation is going to be looking deeply, 100% into all of the issues. So we have Galina Izotova, who is the Deputy Chairman of the Federal Audit Chamber. Galina Zhidkova, very happy to see you in the studio. Also, we are going to have a long, you see one chair is still empty, but Moscow, in as far as coronavirus, not only makes so many changes, but also climatically, we had a great snowfall yesterday and today, and so coming soon will be Elena, Zhidkova, who is the senior manager of the central office of the healthcare system, corporate healthcare system of the Russian railroad system. Online we have Elena Kartasheva, who is the president of Takeda. Elena, my respects to you and thanks for joining us. And Stephan, Eder, Executive Vice President of the STADA group of companies in Russia and CIS. Stephan? Hello. I'm very happy to see you joining us. So, dear colleagues, let us begin. Yes, it is true. The patient-centric model is a whole system, not a single country in the world, to the extent I know, hasn't yet achieved any exemplary state that everybody could point their fingers to and say that this is the real patient-centric healthcare system. A lot of things being individualized and personalized, like medicines and approaches, and the illnesses themselves and the diseases acquire new forms and begin being treated in a new way. The healthcare specialties are being defragmented, and financial issues also add a lot of challenges to it. It's not for me to tell you that in Russia we've got a multi-tier cake in the healthcare system, which includes the federal organizations, regional one. In some of the regions we still have municipal healthcare in terms of how the local healthcare is being organized. There's also the federal agency own healthcare system, as well as the corporate healthcare system. So let's look at it one by one. So Galina, again, our first question is to you. In this diversity of healthcare examples, financial ones, under such turbulent, continuous reformation circumstances that our healthcare system is surviving through, to what extent we could be effective in building this patient-centric model? Are we going along the right journey? What we are lacking? Thank you. Thank you. I would also like to welcome all of our esteemed colleagues. Yes, of course, this is the very proper way to go, because the patient-centric model in itself is the kind of a model when, at a very high effective level, there is a collaboration between a patient and a healthcare system representative or a healthcare professional. And this is possible only when the information and emotional parts in it are closely knit together. And so under the current conditions, the way the World Health Organization concludes, in no country in the world this model has yet been established. And to a larger extent, this is being viewed as a principle rather than a model which needs to be instituted, but rather than a principle. And this is a very proper way to go, a very logical way to go, because its ultimate objective is to protect the rights of a patient, because the patient is entitled to choose a doctor, to choose a regimen, as long as he understands it. Of course. The patient has the right to be heard, to be listened to, and all of the healthcare services must be available, not to waste time in a lineup, so that all services, irrespective of any specific region or a city or a township, to be synchronized. And like I've mentioned, it is very important the way a very good information system is built, and we are currently going exactly through this journey. At which point are we? Closer to an ideal model or at the very beginning of it? I believe that we are going through the first phase of it, because we do see, and apparently we're going to discuss it, I mean, how many problems we still have in the primary care, how many problems we still have in the provisioning of medicines. Of course, the Russian Federation, based on the 2020 results, if we compare not the funding system, but the size of funding available with other countries as a share of GDP, we will be over 5%. I mean, through the additional contributions, yes, through the additional contributions which from the federal level have been allocated into the system, we expect that this percentage is going to be more than 4. A very big share of out-of-pocket spending. We are comparable in terms of spending to other countries, but, excuse me, to develop a patient-centric model should be not with the available, amount of funding, a much bigger one, because in other countries we see that it's 8, 9, and 12%, and they haven't countered the epidemic the way we did, and we're looking at the deliverables in terms of the efficiency of them, and even against such a minimum amount of funding, in terms of the mortality rate, fatalities, and the amount that we take on in terms of achieving the target in treatment, is not just puffing out our cheeks. I mean, absolutely correct. We are the best, and here one should understand the two very important components. The stability, resilience of the healthcare system in our case is very high in the first place, no matter how I'm saying that one should increase funding. It is high in terms of financial component. The resilience of financing availability, one thing, then respective reserves have been set up which do help us to withstand respective challenges, and of course the whole of the federal customer oversight system has demonstrated such a great quality of the work it did, and it was kept on going, and so that really was a victory for us. If you recall, about 18 months ago, and even more, there was so many negative criticism, i.e. that the system was archaic, that it still have this redundancies of this Professor Simashko methods and system, and so this mixture was such exasperating, and so like what the problem the Italians had, they couldn't mobilize themselves because all the healthcare system and clinics and hospitals were private, and nobody could really take everything and pull it all together and regulate it quite vertically. In our case, it was like in the army, in the Ministry of Healthcare, customer oversight, regional healthcare organizations, everything was mobilized and started working. I really recall my own case. In one clinic, you have the ventilation. In another, it's either a very old one or doesn't working. And we have the authority as the regional Minister of Healthcare to relocate the equipment from one clinic to another clinic. But just imagine trying to do the same thing in Lombardy in Italy or in the United States. These are all private clinics. You wouldn't be able to do that. So in our case, it really was all possible. Yes, this is very much true. And the issue of creating vaccine, you see, we are ahead of the whole planet. We have organized and we have a very powerful institutional foundations which have been preserved from the old days, and it's really great. But there are enough problems to cope with because there are things to discuss and solve. Yes, without doubt. Thank you very much, Galina Sergeyeva. So we're now looking forward to have also another speaker to join us in the studio. I'm being told that Elena Zhidkova is about to join us. Yes, here is Elena. Please come. I know that you have already been wired to the microphone. Thank you very much for being with us. So let us not deviate from the previously agreed scenario and script. Personalized approach in organizing treatment of patients in a corporate healthcare system, in an agency-organized healthcare system, in an inpatient kind of a setup. Your example, because we believe that the experience of the last year is quite valuable in terms of what you're able to share with us. Thank you very much. There are a lot of things that I could have told you, because indeed in our network we have a lot of background and history, 177 years since the organization of the healthcare system in this country, and we do have certain preferences in terms of the patient centricity, because from the very beginning we have already defined who our patient was to be, our patients who are attending our institutions, and of course the image of such a patient, all of his or her wishes and competences is something that we have already defined to us, and we have organized our patient-centric system specifically aimed at such a person. But we also know that the federal legislation 333, when it came into force, and it had in it that absolutely any citizen in the Russian Federation can define for himself or herself the healthcare institution, even his GP. We started changing a little bit since, because we also opened up ourselves for the insurance-based healthcare, and the government-based healthcare system started changing a lot because it was able to see that the patients can go to totally different other organizations in the private ones, and so the corporate healthcare systems participated in the insurance-based healthcare. But in our case, what is really very important, several founding points. First of all, of course, internal corporate culture, which has been around for many years. Indeed, we are not changing it. We've got a code of conduct that all of the organizations follow. And here, absolutely every employee of our healthcare institutions, of all our healthcare institutions, they learn it by heart. We even run them through a bit of a testing, particularly for the new recruits who come to join this system. And that starts from the security, from the registration personnel, all the way to the leadership, all of the links and the levels of our HR system. Second is continuous training, because once a year we hold workshops for absolutely different, I should say, groups of our employees. Again, this could be entry points, this could be specialty care wards, and the administration personnel, and the third, working with our partners and counterparts who also come back to us with certain innovations. And here we do the analysis and the audit of the environment where we operate, and the analysis of our competitors, and also trying to master the kind of innovative methodologies that they follow. This is very living kind of a system in terms of the patient's interest in organizations, because we have to account any experience that emerges every year. And so this year also turned out to be, like in the case of the whole country, for the rest of the world, was absolutely unique, and the unique experience that we're able to generate, we would also be very happy to share with it. I would say that for some it could be something that is quite new, because introducing telemedicine technologies and digital technologies, the remote control over the healthcare of our employees, is practically something which is fundamental for our further development, particularly in regions where it is very difficult to get specialty high-tech healthcare. This is the northern territories, this is our employees, and the people who live in Russia, let's say along the Baikal-Amur Railroad, where it is very difficult to get available and really good quality healthcare aid. And so new technologies are being introduced for that purpose. There used to be technologies in the past, but this year they really took a leap forward because it took us a lot of time to introduce a serious network of telemedicine healthcare in order for it to work, just to, you see, exchange experience and knowledge, to communicate between our institutions so that all of our colleagues could get in touch with each other and hold joint councils. But this year it really went over the top. During the first 3 months, this first wave, 7,000 people received the telemedicine service. 7,000. It was really quite a number because it was a totally new field, totally new way. And we know that there are so many interesting providers in Russia who measure these services in dozens of thousands, and they really made it a priority. For us, priority is in-person ability to communicate when treating a patient. But again, I would like to say that the patient centricity in itself, yes, it's been around for quite some time now, because back in our college years we were taught that we should treat not the disease but the patient, and so I would say that this is exactly the kind of the fundamental basis to develop the patient centricity, because the patient himself must choose the doctor he should go to, and it's for the doctor to decide what should be done with the patient and not just with the disease itself. What I wanted to also say about technologies are very important, and here we began cooperating, I shall repeat it again, with some major providers, trying to connect them into this campaign. And the fact of the matter is, a lot of new services have been introduced. I simply want to avoid repeating it again, like the remote screening for the COVID, for example. We originally had it as part of the services. Now it also has cardio screening, respiratory screening, and it demonstrates very good results. Nowadays we do the medical record screening, because for some time we have a lot of people on our staff who are analyzing patient records. We know how much resource in terms of human resource it requires. So half of the network right now has been switched to a kind of a digital approach, because we have introduced the information system as part of the AI. Yes, we are continuously gaining new knowledge, and so the medical record is being checked by a computer, because this is the part of the big data, and selects errors, and we've been able to reduce, because some people went ill, others were put on the remote work, and so a lot of experience, and there are a lot of examples like that. Yes, effectively, Elena, I was looking for a possibility to say thank you. You don't know what for, but I'm going to explain. In Nizhny, Novgorod, which is not too far away, much closer than the Baikal-Amur railway, like the Northern Territories, but there's also a railroad corporate hospital, and when the struggle broke out throughout the whole country in the person of coronavirus, your colleagues, in a very agile way, were able to reorganize themselves and took on additional volumes when inpatient institutions were being closed because of coronavirus and had to be converted from the ordinary clinics into the specialty clinic. Your hospital there was able to really help, and great many thanks to you and your colleagues. Were you ready to face such a mobilization? Oh, thank you very much for these words of thanks, because this is the kind of work that we were doing throughout the whole country, because during the first pandemic wave, we were opening COVID hospitals. They're still open in Moscow, in the city of Perm, but the main effort to convert a healthcare institution in an emergency, because we really didn't do much of an emergency, we didn't have much of an emergency experience. For example, we, in some cities, we were made responsible for the surgery aid for the whole city, because of the Russian railroad, where practically like a paramilitary organization, where everything is being done very quickly, so we didn't face any problems here. Thank you very much indeed that at the regional level you are part of a big team with the local executive authorities, with the local healthcare institutions. I mean, not only educational ones, but the ones which organize the the healthcare system as such. Now, let's move over to our following speakers, because we have connected to us Elena Kartasheva. Let me remind you that she is the president of Takeda, a company in Russia. Elena, I can see you. Yes, Elena, I've got the following question. The big pharma has always been associated with something innovative. Innovations always crazily expensive. This is always a complex market access strategy that has to be individualized per an individual group of patients within a specific region. So that means quite cumbersome expenses that companies incur when bringing an innovative product to a market. So looking at it through the big pharma, innovative approaches to the patient-centric healthcare model. In your case, let me put it this way, is it a priority, your mission for your company, or is it just a uniform standard that the whole of the pharma industry should comply with, irrespective of who does which work? What kind of principles of patient-centric approaches you, as the business, translate onto the healthcare system? Well, first of all, I would like to say that this is quite an interesting topic, and it speaks for itself. Patient-centric healthcare, which really supposes that the patient is in the center of everything. And without doubt, what we're moving towards is that the mission to be patient-centric not only becomes important for the pharma companies, for the patient community, for the HCPs, but this is something that the federal authorities are paying scrupulous attention to. And the patient-centric healthcare, in the first place, is about setting the right priorities when we're saying that the patient's interests are above all. And I would say that this must be something of a comprehensive thing made up of several parts. And today I would like to cast a glance upon some of them, although I'm sure that that would not be the entire list. Galina Sergeyevna mentioned a few things very properly. Financing and funding. Without it, no doubt, further improving the approach to treating patients would be impossible, because you've got to have federal money for that. But as I mentioned, this is the system, and the system includes several components. Apart from the need for the government to have money for it and to cover and support such a patient-centric model to a very large extent, it's about the patients with rare diseases. At least I can refer to this group as an example. And one of the key components is the diagnostics, because this early diagnostics enables one to start a timely treatment to avoid disability, as well as developing comorbidities. Yes, we've been able to advance ourselves thanks to the development of the modern healthcare. We've been able to make sure that some of the diseases from the fatal one were moved into the category of chronic and well controllable. For example, such an inflammatory disease of the gastrointestinal tract, because these days, once we start treating these patients, it's possible to avoid surgery. They are able to achieve a very stable remission and go back to their normal life. An example of a successfully implemented diagnostic program would also be a neonatal screening in Russia, which in Russia currently includes 5 hereditary diseases. Just for comparison's sake, in Russia, these are 14 nosologies which are included into neonatal screening, although in a number of regions, they independently do expand this list for the neonatal screening, now improving the availability of the innovative methods of treatments. There is a great number of different practices and innovative treatments, and I will give you an example. Let's say patients with a Fabry disease who are going on a ferment substitution, they're living on average 7 years. Like without treatment, they would live only to 60 years. So we are giving them additional 17 years to make sure they live until 77. Hemophilia, 100 years ago, their lifespan will be 13 years. 60 years ago, 20 years. Nowadays, they're able to live up to 77 77, 80 years. So introducing innovative treatment into the healthcare practices definitely requires additional funding. And there are so many different programs, very specific programs, the programs to share the risks and costs, long-term contracts. So undoubtedly, these are the things which are extremely vital and important for this country. Long-term contracts do offer a lot of benefits for the government. This is a great efficiency in the allocation of funds, as well as the enough timing to do the tendering for the producers. This is protecting the investments and additional investments done into the development and manufacturing. For the patients, the most important thing is to achieve stability and continuity of supply of medical products. Another very important part of it is improving the availability and affordability of the innovative treatments, like expanding the programs for earlier access, thanks to which the patients are able to get the medicines they need even before they are registered, especially in this country and in Russia. Currently, very actively, such programs are being used. Technology transfer. This is the topic that is long-standing, and many companies do it, and they bring their technologies into Russia, and even Takeda, despite all of the restrictions that we've had to go through last year because of the pandemic, we didn't put it on hold. We launched the production of one of the innovative products to treat the patients with the multiple myelomas on our Yaroslavl factory, and other pharma companies are active in transferring their into Russia. But alongside with that, I would like to mention that the programs aimed at improving the availability of innovative treatment to the patients, it is related directly to complex and comprehensive measures before and after the diagnosis, particularly if we're talking about the patients with rare diseases. Recovery. This is the post-treatment monitoring, consulting and advice, then raising the awareness among the family members and training, transportation to the treatment center, and vice versa, and setting up inpatient centers near homes. So all of the things are included into the so-called notion of a patient-centric ecosystem. And not always it really generates a lot of burden for the public funding, but it enables one to produce a lot of good effect upon the quality of treatment, upon the quality of life of a patient. I may have missed on some of the components of such a patient-centric system. There are many more of them, but we have a very firm confidence that this government is already paying a lot of attention and will be paying even more of an attention to setting up such a scholastic system that would take into account all of the needs of patients. I suppose it would really make sense to also consider the possibility of setting up some sort of a working group under the aegis of the Ministry of Healthcare in order to establish a direct dialogue amongst all of the stakeholders in this process, between the government, the businesses, between the expert community, between the patient community, in order to develop measures aimed at creating such a uniform system which will be in the first place aimed at supporting the patient, particularly the patients with the rare diseases, and creating terms and conditions which will be conducive to the patients enjoying very timely and high-tech effective treatment. Elena, thank you very much. With your permission, I would have a question right away. Of course, we can go into the format of working groups at the level of the Federal Healthcare Ministry or some other institutions which either regulate or assess the work of the healthcare system. But having done some work at the federal level, as well as for 12 months at the regional level, you understand a lot of things have already been written down, like in this or that phrasing, you find it in the regulatory documents, but what is not there, and this is my personal experience, you may disagree or disagree with it, you know, the skill which is automatic. We read it down on paper, but in terms of the skills to do it exactly as it's written,
No, we don't see. In my past life, I also worked very closely with you and your former colleagues. So the skill can only be achieved through repetition and training, not through the system of education, which in time really is being extended. And in educational form, it's more of a preaching kind of a thing to translate it to those who are being educated. But just, you come to a certain place, develop a skill of what should be done to a patient with a rare disease, and what we are to tell to the family members of such a patient, what we are to do, how are we to behave within the environment that the patient is in. So this micro skills is what I feel would enable us to turn such a system very quickly into a very patient-centric. So what do you think about it? You see, I would think that this kind of a skilling is very necessary to have in anything that we plan to do in life. But before we acquire such a skill, I feel that it is necessary to do some sort of an internal diagnosis of the whole chain, of the whole link, and take a look at it through the mind of a patient. What happens to a patient since he or she is being diagnosed until the point in time when he or she or the family enjoys absolute calm in terms of the treatment that is required for such a patient? Because after the diagnosis is set until 100% satisfaction is achieved, a lot of steps need to be made. Have you ever paid attention about how much time it takes when a diagnosis is being issued and when a patient realistically starts getting the necessary therapy? And whether everything around this treatment we can make available, because apart from a drug, these patients do need a lot of other things to be provided for them. And so, to begin with, why I'm saying that, it seems to me that the working group is what we should have, that you have to diagnose first at which link we have this is the weakest one. And when we'll be able to understand that this is the stronger, this is the weaker, this is the weakest link, then we will be able to understand how the system should be set up in order to develop such skills. But to begin with, we need to go along the whole chain, the whole chain of steps. Yes, Galina, you wanted to add something? Yes. A very important notion of skills and the chain steps. But, dear colleagues, we also have to go back to the basics. And what I mean is the clinical guidelines. You, as a representative of the regional authorities, should be very well aware that for the financial system of any region, the clinical guidelines covering all kinds of diseases and the norms and the standards do represent the foundation and the basis for treatment. And these two components should also be the basis for tariffing. And then it pulls me back to my favorite topic, financial stability or the financial foundations for the resilience of the healthcare system. That would give us the opportunity to calculate how much money exactly every region needs, because this point is also part of our discussion agenda. But this particular issue, whether we are setting up a working group or not setting it up, this is the must thing. Yes, well, that's what I wanted to say. Very important comment. Stephan, Eder, I would like to introduce to you the Executive Vice President of STADA Group of Companies in Russia and CIS. Stephan?
Interpreter will work simultaneously. That is why do not interrupt yourself. Speak English fluently, and our colleagues will interpret you simultaneously. То есть перевод будет синхронно идти, поэтому...
So this is going to be done in simultaneous translation, so if any of you are using the translation devices, please use them, because Stephan is going to speak English. So Stephan, my question is this. You have worked in many other countries, and I'm sure that you've been able to experience different healthcare models. Now you came back to Russia, and you know Russian system quite well, and so the practices that you've seen outside of Russia, to what extent they can be translated upon the Russian reality, in what it is that we can specifically borrow from our foreign counterparts so as to introduce it into the Russian healthcare system, please.
Thank you very much, David, for the question. And yeah, excuse me for speaking English. I mean, first of all, I'd like to mention that I fundamentally agree with the thesis that indeed patient centricity needs to light the heart of every healthcare system, and also that patient centricity can only ever be achieved by a strong collaboration between all players in the ecosystem, in the health ecosystem, be it pharmaceutical companies, governments, regional or federal governments, but of course also medical professionals and the medical infrastructure at large. Now, I mean, what can we learn from healthcare systems across the world? And I'd like to take 3 criteria along which healthcare systems typically are measured. And first one is efficiency or cost. Second one is outcomes or effectiveness, and the third one is access or equality or fairness of access. And the first one that is typically looked at is costs. And my esteemed co-speakers have said that a current constant measure is GDP, healthcare expenditure as % of GDP. And there are countries such as the US at nearly 17% of GDP, where we can say this is probably the inefficient zone. There's an overinvestment that doesn't reap additional benefits. But if we look at European countries such as Germany, Austria, or the UK, this is in the area of 10.5% to 11.5%. And in Russia, we have seen, and I think this is very pleasing to see over the past, that there has been a significant inflow of funding into healthcare, and we reach now a level of 5%, which is good. But at the same time, we have the possibility to invest even more, because in the end, the healthcare system is not about costs. And I speak here on purpose about investment, because it's all about driving outcomes for patients and better effectiveness of treatment. And I think that brings me to the second point, effectiveness or outcomes. A very crude measure is life expectancy at birth. And in the 3 European countries that I mentioned before, it hovers around 81 years. And in Russia, it's slightly below 73 years. So I think with increased investment, we can also strengthen the health and well-being of the population at large. And that is, in the end, what a healthcare system shall achieve in the end. And then the third one that I mentioned is access or equality of access. And I think this is a very interesting one. And I think here Russia has a unique potential and a unique possibility that is distinct from other countries. And say it's the strong tradition and medical foundation that also my esteemed co-speakers have mentioned that exists in Russia. We have a very large and highly educated medical workforce, doctors and nurses. And this is at a level that is very much comparable, say, to Germany, with 4 doctors per 1,000 population, ahead of, say, the United Kingdom, where it's 3 per 1,000 population. So I think Russia has here a real treasure and a strong heritage. And I think you mentioned also, David, at the beginning, this has very much come to fruition in the crisis that we are currently facing. And Russia is weathering the storm, I would say, much better than in many other countries, because doctors and nurses who treat patients on a daily basis, the heroes in our fight against COVID, they have done remarkably well. And the government or also companies have invested into creating additional medical infrastructure in order to treat patients even better. And I think also the strong scientific tradition that exists in Russia, with a strong and fast development of a vaccine that shall bring us back normal life and again help the health of the population, was a remarkable achievement. And I think, as I said before, the patient centricity requires that all participants in the healthcare spectrum collaborate closely together. And as a member of the pharmaceutical industry, and STADA Nizhny, of course, is no stranger to you, David, because you are the health minister of the Nizhny Novgorod region, which is our home region. I mean, for us, it's also patients are at the center of everything we do. If I look at our mission, taking care of patients' health as a trusted partner, so patient as well as partnership is at the core of what we do. And with the large portfolio of medicines that we have, generic medicines and consumer healthcare products, we do a lot in order to be able to improve outcomes in a cost-efficient way and also strengthen access. Yeah? And with the strong commitment that we have in Russia, we have 2 manufacturing sites, for example, in Russia, in Nizhny Novgorod and in Obninsk. We have, with more than 70% among the highest degrees of localization. And Russia is for us, as an international group of companies, a very important market. I think we have a lot to offer in order to contribute to this never-ending quest, I would say, to improve patient centricity of healthcare and to make healthcare stronger in Russia.
Stephan, спасибо. Если позволите, вопрос...
Stephan, thank you very much. If I may just give you a bit of a question for your food for thought. Since the 1970s, from the last century, there appeared something of a Preston curve. This is a kind of curve along the x-axis, healthcare costs along the y-axis, the average lifespan in a given country. And so all of the countries, they were positioned along this Preston curve. The closer to the curve the country was, then it meant that the healthcare system there was effective, because by one of the principles as cost effectiveness that you referred to, so all of the countries with big territories like US, Russia, Canada, all of them had certain margin of error in this effectiveness, because that was not only about a very compact municipal system, but a very widespread system, meaning rural, urban, northern territories, southern territories, many time zones, megapoli, very diverse healthcare system. So this correction in terms of the space that any given country is represented in terms of the efficiency and effectiveness, or let's say, speaking about the healthcare effectiveness in Moscow, should it be specifically identified in between a little town place, a little borough or a district? What would you say, like a person who went through the experience of working in countries represented through such a diversity of territorial administrative points?
Well, I mean, of course, I mean, I would say it's a constant challenge, right? I mean, every healthcare system has to deal with the fact that there is a discrepancy in treatment between, say, urban centers and rural areas. There is a discrepancy in treatment between the most affluent parts of the population and the less affluent parts of the population. But I think the fundamental principle we should always remind ourselves, I mean, every patient's life is of equal value. So, I mean, that's why equality of access is something that is supremely important. Again, I think with the strong healthcare infrastructure and the strong and highly educated and numerous healthcare professionals that we have in Russia, doctors and nurses, we have here a unique opportunity to really bring, so to say, a level playing field. And that's why, yes, of course, in a big country such as Russia, Canada, or also the United States, regional variance will always be something that needs to be monitored and worked at. But I think we have everything that it takes in order to ensure this equality of access.
Спасибо, Стефан. Спасибо, Галина Сергеевна. Да, прошу, есть что добавить.
Thank you very much, Stephan. Thank you very much. Galina, again, will you be able to say something? Yes, I do have something to say, and I would like to support Stephan, because if we are indeed to follow towards the patient-centric model in the Russian healthcare, we must, by all means, solve the problem of access. Because access to healthcare, effective healthcare, this is an entitlement that any individual must have to be able to be referred to HCP individually or remotely so as to discuss a certain issue that requires attention at any given point in time. Here in Russia, we like to say that we, in the Russian regions and overall on the federal level, there is a program that is currently being worked which will enable, yes, modernization of the primary care, yes, which will in a serious way help us to solve the problem of primary access. And this is really great, because that would be truly developing the healthcare in the form of the local institutions, local healthcare offices, which requires additional installation equipment, renovation, and new construction. But another very important consideration that comes out of what Stephan just told us The inequality that we, as the Federal Audit Chamber, are acknowledging, I mean, it's not right to really describe it as inequality, not even disbalancing like you're suggesting. I would rather say the lack of accounting for differences in different Russian regions. The differences, we've got such differences, we've got such a great, diverse country. Somewhere in terms of the household utility sector, you require a certain number of funding. As a norm, we've got indices and ratios. So apart from these differences, the availability of material and equipment and the ones related to the specificity of diseases, that must be dealt with. This is also one of the key points, and we believe that it can be solved in a simple way. The only thing we need is to change the methodology of the way the federal subventions are being allocated down to the regional level. Yes, we should really give you a big hand for these words. This is a very important thing. Yes, we're rounding up the discussion about it, and so next week we're bringing it up to the level of our chairman, Alexei Kudrin. Or yes, you can invite us. We'll be more than happy to participate, because yes, we believe this is the key thing that must take place. Galina, again, thank you very much. We've got just 1 minute left to do, just like in a tweeting mode, just one statement. What are your plans to achieve the patient-centric model in 2021? What specifically has to be done? Just one phrase from each of you. Elena, let's begin from you. One phrase, just one phrase. The uniform standards and approaches. Uniform standards and approaches. Galina, well, I shall repeat it again. Standards. Clinical guidelines, further improving the model of allocating subventions down to the regional level in primary care. Excellent. Elena, Kartasheva, just one statement. What in 2021 needs to be done? Are you still with us? Yes, I'm here. So 20 seconds left. Please tell us. Comprehensive approach in order to study all of the components of this process. Thank you. Stephan, what would you say? 5 seconds, please.
I would say it's tight collaboration between all players, partnership in the healthcare ecosystem.
Thank you very much. So the spirit has materialized itself. Thank you very much. I wish you good health, and please stay put with the Gaidar Forum. Thank you very much.